Now we'll talk about a very important stuff, and this is as related to you trying to determine how somebody's bones are still strong, So we call this fracture risk prediction. I'm trying to predict if you possibly have a fracture very soon. Then we have osteoporosis screening. So all of them is just all around, weak bones assessment. So for these two things, we said that fracture risk prediction and osteoporosis screening, all of them, they're essential for what? Identifying individuals that are at the risk of having weak bones. So because they have weak bones, they can easily, fracture. So what is osteoporosis screening? So it's usually in women that are past 65 years and men that are past 70 years, regardless of if the person has had fractures before or not. So younger postmenopausal women and men aged around 50 to 60 that have risks of that have all those risk factors, like all those low body weight, maybe they have had fractures before, maybe other family members in their family have basically suffered from the same thing, and smoking or glucocorticoid use. So this is how they do it. They use the dual energy X-ray absorptiometry. So this is a score that they use, anything more than or equal to -1. Osteopenia is -1 to 2.5. Osteoporosis is less than 2.5. Okay. So they can also use the quantitative ultrasound. They can also use the trabecular bone score. So fracture risk assessment now is usually developed by World Health Organization, and is trying to look at you in the next 10 years. Is there a possibility of you having a fracture? So they are looking at various. You give them information, right? So from the information you give them, they can now be able to deduce. So you give them information of your age, your sex, body mass index, prior fractures. Have you had fractures before? Have your parents had fractures before? Did you smoke? Do you take alcohol? Have you used glucocorticoids? Have you gotten rheumatoid arthritis before? Have you had osteoporosis? That's for women and elderly men. So it's widely used in clinical practice. So we have the Q fracture. Okay, this is a FRAX. That's fracture risk assessment tool. Then we have the Q fracture, is mainly used in the UKs. So they try to also look at, have you fall down recently? Do you have any underlying disease condition and which type? So they now try to see if the disease condition have a link with the bone, They are taking some medications. Then we have the Gavan fracture risk calculator. It's developed in Australia, considers age, sex, and body mass index. So I think this is what we have for this.